Welcome to Plastic Surgery Talk with Dr. Stephen Mulholland, brought to you by Spa Medica. Hello and welcome, Dr. Stephen Mulholland here in Toronto, Canada on Plastic Surgery Talk, and we have our latest installment of our podcast series. Today's podcast is on a very popular topic, especially for mommies out there, a tummy tuck. We're going to discuss all you need to know about tummy tuck surgery in 2018. Common question, what is a tummy tuck? A tummy tuck is a lay or popular term, a secular term, for a more plastic surgery scientific term called an abdominoplasty. A tummy tuck is the combination of surgical procedures that's designed to rejuvenate an abdomen that has lost some of its useful characteristics of muscle tone, excess fat, and generally loose skin. A tummy tuck will involve excision and surgical repair. That is, we will be cutting away some tissue. Now that tissue is often extra fat and loose skin that has been stretched and expanded as a result of childbearing, multiple parity, multiple kids, 1, 2, 3, or 4, you stretch out and relax, and the skin get loose over time. Some women get a lot of skin laxity after just one child. Some can have multiple kids and their tummy skin stays tight. So a lot of the laxity after weight loss, weight gain, or multiple kids and parity is a result of the DNA in your inheritance. What kind of DNA towards skin elasticity did you inherit? So a tummy tuck has usually skin removal. A tummy tuck can also include repair of a belly button that has gotten covered over, a belly button that has a little herniation or has become an outie can be repaired and corrected. And a tummy tuck generally involves the assessment and repair of muscles that have separated apart, called the rectus abdominis muscle and a rectus diastasis are muscles that after a couple of kids or a lot of weight gain and weight loss will separate and never come back in the middle, allowing protuberance. So a classic tummy tuck is going to be rectus abdominis, suturing together a plication, an umbilicoplasty or belly button repositioning and rejuvenation, and usually removal of skin. Those are the trifecta or triad of characteristics in a tummy tuck: skin removal, belly button improvement, and muscle tightening. So what's the difference between, let's say, a tummy tuck and tummy liposuction? Well, tummy liposuction involves no cutting away of skin. It doesn't involve a muscle repair, and there's no tweaking or repositioning or rejuvenation of the belly button. It is purely just abdominal fat contouring. So when might you be having tummy lipo versus tummy tuck? If you've got reasonably good skin tone, you can undergo a liposuction procedure and the skin will contract. If you've got compromised skin tone, you may need to use a special kind of liposuction, which is very common nowadays, called energy-assisted liposuction, like BodyTite Smart Lipo. This delivers heat during the liposuction process for a good 35% contraction. But if you have really lax skin, the kind of skin when you bend over it goes blah, 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 and wiggly jiggly and it's very loose, it kind of puddles when you bend forward, that's too much laxity for even BodyTite. And then you need to consider skin removal. You may also need muscle tightening and belly button repositioning. So that's the difference between liposuction and a tummy tuck. Lipo is removal of fat but no cutting. Tummy tuck involves some cutting. Are there different types of tummy tucks? For example, what's a standard tummy tuck versus a mini tummy tuck versus endoscopic tummy tuck versus extended tummy tuck? There are different varieties of tummy tuck, probably 4 or 5 different variants. A standard tummy tuck generally goes from hip pointer to hip pointer, or about 20 to 25 centimeter long incision right above the pubic hairline. It involves repair of the muscle from right to the rib cage down to the pubic bone. It involves belly button rejuvenation, repositioning, and youthifying, and removal of skin. That's a standard tummy tuck. An extended tummy tuck are for patients who have very loose skin on the outside flanks, and we have to extend that scar around and past the hip bone and around the corner onto the buttock contour. So it's an extended incision undermining of flank as well as front of tummy skin and removal of that flank and tummy skin. It may involve tightening the muscles, not only the rectus abdominis, but the side tummy muscles called the internal and external obliques, and tightening them on the outside of the tummy. And so that's an additional tummy repair or extended tummy repair. And then a typical umbilicoplasty or belly button repair. That's an extended tummy tuck. A mini tummy tuck is either a limited incision, short C-section suprapubic above the pubic scar, and it generally might involve just a skin pinch with no muscle, or modest repair of muscle below the belly button, or with or without a belly button repair. So a mini tummy tuck is less excision, less length of incision usually, and or less of a muscle repair. So mini tummy tuck, extended tummy tuck, and standard tummy tuck. And any one of those tummy tucks may include liposuction, or the use of technology to remove fat from the lateral flank or love handle, up above the rib cage or the breast or rib fat, and then love handles and bra lines behind the body. So often we'll start with liposuction on the back, bra line and hip, turn, do some lateral or outside flank liposuction, above the rib cage liposuction, and then a mini, standard, or extended tummy tuck. So you can often combine liposuction with tummy tuck to get the best possible circumferential 360-degree improvement. Who's a good candidate for a tummy tuck? Well, like all surgical procedures, a patient should be medically well, should not have any uncontrolled medical diseases that might contribute to complications or risk. So controlled diabetes, controlled hypertension, no coronary artery disease or recent heart attacks, no strokes, and generally should be reasonable weight. I think most patients undergoing tummy tuck surgery should not be obese. That's too much muscle repair, and tightening the muscle could constrict the intra-abdominal space or the ability to breathe deeply. So patients should be a reasonable BMI within 20 to 25 pounds of their ideal body weight. And patients should be realistic. Their expectations should be realistic. We should be able to achieve an improvement, a flattening, a tightening of the skin, improvement in the contour, but we can't make your tummy 16 again. So realistic expectations, absence of medical illnesses, a reasonable body weight, and then in general have the commitment and the ability to take between 2 and 3 weeks off for recovery. 1. How long should you plan for your recovery following your tummy tuck? Well, the answer is it depends on the tummy tuck. It depends on your job. It depends on your age. So let's start with the kind of tummy tuck. Once we have to repair the muscle, the rectus abdominis, or an extended tummy tuck, the internal external obliques, you had a lot of discomfort, a crampy muscle pain, like you ran through the house, you hit your thigh on a coffee table, and you've got a Charlie horse of your belly muscle, and it's sore. You're hunched over that first week. The second week, you're almost straight. The third week, you're finally standing straight, and that really achy muscle pain has become a typical bruise type discomfort. So in general, when you do a muscle repair, you need about 3 weeks off from really active jobs. Now, if you're working from home, you're an independent consultant using the internet and your phone, you might be back at work after a week or 10 days. But let's say a typical office job without a lot of heavy lifting, 3 weeks off work with a muscle repair. If it's a mini modified tummy with no muscle repair, then, and it might be a skin pinch only with a little bit of liposuction, you might only need a week off. For a standard tummy tuck without any extension, generally 2 weeks. So minimum 2 weeks, preferably 3. No heavy activities, heavy lifting. So if you have a little baby that's 2 years old, you need to plan on that 25-pound weight. If you carry big boxes around work, you need more time off or modified duties. So at 2 to 3 weeks back to a sedentary job, normal walking and activities. By 3 to 4 weeks, stair climber, elliptical, more upper body strengthening, but no rectus abdominis. And by 6 weeks, on a gradual return to crunches, abdominal work, planks, yoga, high impact activities. Those are the typical recovery discussions we have with the patient. Now, what if you're older? If you're older, you may have less muscle tone, less stamina, and you may need 3 to 4 weeks of heavy activities. And finally, the last criteria is a job. If you have a heavy industrial manufacturing type assembly line job, you need minimum 3 weeks, probably 4 or 5, till you can withstand the rigors of heavy lifting. If you've got a sedentary, light, more office-based environment job, you could be back in 2 to 3 weeks. So Tummy tucks have one of the longest recoveries of any of the surgeries. You need to respect how much you need for that rest you need to allow that muscle to repair. And no abdominal work, either in your exercise regime or at your day or home job for about 6 weeks. So you've done your tummy tuck or you're planning your tummy tuck. Are there any adjunctive procedures or additional procedures that are synergistic or work well with a tummy tuck to give you the better body outcome? Absolutely. In fact, tummy tuck is usually one of a triad of 3 things that women combine in what's called a mummy makeover. A mummy makeover is generally going to involve some sort of tummy work, a mini tummy tuck, a skin-only tummy tuck, a standard tummy tuck, extended tummy tuck, combined with breast work. Breast augmentation most commonly, or fat grafting to the breast, and a little bit of liposuction, usually on the sides, the flanks, and the love handles. So are there additional procedures? Sure. Liposuction of the thighs, of the arms, of the bra line, the hip and flanks, very common. Breast enhancement surgery could be an augment with cohesive gel breast implants, could be fat grafting to the breast or breast lift, and usually combinations of those 3 things will give you the best post-baby mummy restoration. I often get a question after tummy tucks: do I need to do anything to maintain and protect my investment? Well, the answer is usually not, but perhaps. And so in facial surgery, when you do a facelift, we're lifting up. A brow lift, we're lifting up. A cheek lift, we're lifting up. What happens with gravity and Isaac Newton? He wants to pull down. So every year after year, following face lifting, brow lifting, cheek lifting, neck lifting surgery, there's a tendency to gravity to want to pull it back down. And so we offer maintenance treatments, bulk heating radiofrequency devices that tighten skin non-surgically to try and protect your lift as long as possible. With a tummy, it's quite the opposite. Isaac Newton is pulling down and we're pulling down. So I have many patients who come back now 20, 25 years after their tummy tuck looking to do a facelift, and their tummy looks stellar. It still looks awesome. So you do not need as much maintenance after a tummy tuck as you would, for say, after facial surgery. However, if you're prone to laxity and you have some liposuction on the flanks, or there's a little bit of recurrent laxity of your tummy, a bulk heating radiofrequency device such as VeloShape 3, Excellis, Venus Freeze, Body FX, Forma Plus, some of the more common skin tightening radiofrequency devices can be used to maintain that tautness of your tummy if you find there is a little bit of laxity over the years. Tummy tuck surgery, like all surgery, comes with risk. In fact, when you're considering surgery like a tummy tuck, you need to consider, what are the benefits? Are the benefits worth it? A flat, tight tummy with some reduction of your love handles and improvement of the belly button that lasts the rest of your life. Clearly, many women find this is of huge benefit because it's probably the 4th most common surgery done. So the benefits, you need to consider the recovery. Can I take 3 weeks off my busy life? Is it something I can donate that time to? So 2 to 3 weeks of pain for a lifetime of gain. Third, what is the cost? Is a tummy tuck with or without breast and liposuction surgery affordable? Is it something that I can spend my hard-earned after-tax dollars on? Is it going to be worth it to me? And last, when you think of all those variables, what are the risks? Are the risks worth taking? Are they common or extremely uncommon? And are they divided into life-threatening or wound healing risks? And so a good discussion on the risks, the benefits, and the recovery in deciding whether to do a tummy tuck is a very important part of deciding whether to proceed. What are some of the common complications? Wound healing, such as a small separation of the incision, because most surgeons, like myself, don't use outside sutures. We use inside dissolving sutures. You may spit some of those out. So a bit of delayed healing. The scar can be raised or red and may need some treatment. There may be fluid collection under the skin called seroma, and so often drains are used for 1 or 2 weeks to allow that skin to stick down. And at the end of the day, after a tummy tuck, sometimes you need a little liposuction of that lower flap because you get a bit of muffin topping of the fat you pull down and skin you pull down next to the scar. And so sometimes post-tummy tuck, a lipo contouring at about 6 months to a year. These are the more common complications. The rarer complications always sound a bit scarier, but they're extremely uncommon in a well-executed tummy tuck in a healthy patient who's a good candidate. What kind of discomfort can you expect from your tummy tuck? Well, depends on the type of tummy tuck. If you just do a skin pinch with no muscle work, or skin only with some belly button work, it can be one of the least painful procedures that we offer. Once you recruit muscle into the muscle repair and you're passing sutures through the muscle and tightening that muscle, you're going to have some significant discomfort. Now, what is the relative assignment of this discomfort in comparison to other surgeries? Well, let's put something like childbirth, having a baby, a transvaginal delivery with a little bit of an epidural or transcervical anesthesia, as an 8 out of 10 on pain. 9 out of 10 would be spine pain for spine compression, neuropathy syndromes, back surgery around the spine. That's very painful. Then there's lung surgery where you cut through the ribs. That can be quite painful. Bowel surgery. We're talking, 8, 7, 6 out of 10 on pain. Where does tummy tuck rank with that? Generally around a 5 or 6. So it's kind of middle of the road pain on the grand scale of 10 being the strongest, 0 and 1 being the least painful. Now, once you back out the muscle repair, it's not nearly as painful as some of my other surgeries, such as breast augmentation or multiple site liposuction. So once you lift the skin up, there's almost no feeling after. That's part of the normal recovery. In fact, you go from really a little incisional pain to no feeling at all. So skin only tummy tucks, mini tummy tucks, are about a 2 out of 10 on pain. So it depends on the type of tummy tuck, and then of course on how tough the patient is. Some patients have a procedure, it's the worst pain they've ever had. Oh my goodness, I can't believe how painful that is. The next patient has exactly the same procedure and finds it a mild discomfort. So there's obviously variation in how patients interpret pain. But tummy tuck with muscle repair, plan on a significant discomfort that needs some narcotics for 2 or 3 days, followed by an anti-inflammatory, and after about 10 days, reasonable return to quite mild discomfort. What kind of results can you expect from your tummy tuck? Well, depends on the type of tummy tuck and the problems you have. Do you have muscle weakness and bulging? Do you have loose skin? Do you have stretch marks? And do you have extra fat? If you have all 3 variables, you can expect a pretty astounding transformation in your abdominal contour. It is like a massive transformation generally for most patients. You need to exchange that nice flattening, tightening, and firming for a scar. The scar should be well hidden in any kind of bikini underwear that's reasonable, and a reasonable scar around the belly button. So you should expect a very excellent result. In fact, return to the kind of tight skin, abdominal contour that you might not have had since you were in your late teens, early 20s before kids. That's what you should expect. Now, what about a mini? Let's say you're not obsessed with the tightest possible skin. You do a little skin pinch at the bottom. You can expect a very nice and noticeable improvement in your contour. You may still have some bulging or separation of your muscles, but the skin will be taut, the skin will be nice. And so I think your expectations and your bar for outcome anticipation should be set high. You should expect a very nice transformation of your abdominal contour. There's lots of before and afters that I as a surgeon provide to give patients a sense of what kind of outcome can they expect. And I think that you just need to plan your busy life around a procedure like a tummy tuck, because there's a lot of recovery and that requires you to be actively involved in that process. What happens if I've had a tummy tuck and I get pregnant again? Common question. If you get pregnant again, it's not a disaster. Yes, your baby, no matter how tight I tighten that rectus abdominis, isn't going to get squished and turned into a midget because you have a tight abdominal wall. What'll happen is your belly will gradually distend, and over 9 months you'll stretch out that beautiful repair that we did with your tummy tuck. So you may have to come back when all the dust has settled with an unplanned pregnancy, and once things have settled and laxity may have taken over again, you have to redo the tummy tuck or the repair. But it's not a disaster, and it certainly won't harm the fetus. What are the ranges of cost that you're going to see for tummy tuck surgery? With extended tummy tucks, depending on the surgeon and the city and the experience, you might see ranges between $7,000, $8,000, $9,000 and $14,000 to $15,000, depending on the size of the patient, the BMI of the patient, and how far around the sides that excision needs to proceed. For a standard tummy tuck, the going rates in Canada are somewhere between $6,000 and $10,000, depending on the city, the patient, the size of the patient, and the surgeon. And then mini tummy tucks, little skin pinch with some adjunctive liposuction, that's often $6,000 or $7,000. So for the massive improvement and the lifelong gain from this surgery, there's a lot of bang for your buck in the pricing of tummy tucks. So those are the costs of a tummy tuck. How do patients actually pay for this? I find increasingly that 30 to 40% of all my patients, that's after 22 years in practice, will finance their tummy tuck. They'll go to a third-party finance company, their chartered bank, or a lending institution such as Medicard or iFinance Canada, that very quickly will go through the variables and factors of your credit score and your social and personal and employment life, and within 30 minutes can provide you a reasonable interest rates on loaned funds, and you can pay for your tummy tuck over 5 years every month until you own it at the end of that 60-month period. So financing, very common. Didn't used to be like that, but is now a very common way for patients to free up money, so you don't have to pay it all up front. You pay it over many months, sort of like a car loan. And when the car loan's paid off, you own fully your tummy. The difference between the car loan and your tummy, if you default on your loan, Medicard, the finance company, is not going to come and repossess your tummy. How to pick your surgeon for a tummy tuck. Really, that could be extended to how to pick your surgeon for any surgical procedure. Well, first of all, do your homework. What procedure you're looking for, what kind of tummy tuck. Search then surgeons and plastic surgeons that are certified in your area. Do a local search of your city. Find out which surgeons offer tummy tuck. And then I would take that search engine results page and I would do a little deeper dive into the quality of that physician. Go on the website, check out the tummy tuck section. Look for a photo gallery. Look for some evidence of feedback or testimonials. Maybe they have a video on the procedure and their thoughts and beliefs on how tummy tuck should be performed. You should also be able to go off their website onto social media, Real Self, RateMD, Yelp, Google+, Facebook. Look for rating sites where you see independent reviews from patients about their experiences at that clinic, maybe even ones that had a tummy tuck. You might check out their social media, see how engaged they are, how they engage with their customers. Get a feeling for the staff. Are they warm? Are they kind of inviting staff that's going to help look after you in that recovery period? How long has the surgeon been in practice? Experience matters. Generally, you're going to be better after 20 years and 2,000 tummy tucks, like I've had, than you would just out of practice. And so experience likely matters. You want to look for any complaints to the provincial college where you might be located, which you can search the college in your province and any complaints against the doctor. You can see if the doctor has ever been sued successfully or been charged with any criminal behavior by simple online search. Then you want to have a consultation, meet with the surgeon and the team and the coordinator and the nurses and see if there's a good fit and a good feel. Make sure they feel confident that they can achieve what you want. Make sure your goals have been addressed, the recovery has been discussed. Make sure you ask the surgeon what's the worst complications they've had with a tummy tuck and how did they manage it. At the end of the day, when you go through that long list of variables and criteria, you're going to be left with a gut feeling. Do I trust this doctor to enhance my tummy? Do I feel they have the experience and the reputation to deliver what I want? And do I want them and that team looking after me? Do they have a warm, caring, inviting environment that leaves me feel that I'm going to be well cared for? This is sort of the approach to selecting a surgeon for any surgical procedure that you might consider. Well, thank you again for joining me, Dr. Stephen Mulholland in Toronto, Canada, on Plastic Surgery Talk with our Tummy Tuck podcast. I hope you found this informative, entertaining, and interesting, and if you did, please take the time to share this on all your social media channels and join me next time at Plastic Surgery Talk for our next podcasts.